Dr. Myers.
Yes, my concern was also very similar to hers, especially the data. As a person who's involved at the national level with a data privacy advocacy group, this is concerning because what is not understood, clearly understood, is something called SIF, which is, excuse me, you have interoperability programs going on. You have the SIF, which is the school interoperability framework. You also have it at the medical records. We're seeing this with the Affordable Care Act in terms of the electronic health records initiative, that states are being given grants in order to become part of this. Now, I have a packet, the folder of which I gave to you. I'm just going to walk through these. I put them in order so that I could quickly go through these. But again, there's some red flags. And here's the thing about the passage of certain bills. What happens at the legislature and the intent at the legislature is not always what happens at the sidewalk level when it hits the ground, so to speak. As someone who's been researching policy for, almost a decade and a half, with the No Child Left Behind bill, they didn't anticipate certain unintended consequences because they didn't understand all of the mechanisms that were going on. If you look at the first document, this is from the Affordable Care Act. Within the Affordable Care Act, they're basically saying that they want to implement wellness checks, that they want to provide for wellness checks. On the second page, and I tried to highlight this so you didn't have to search for it. On the second page, you'll notice that they are including within this, not just immunization, but they're upping it to include mental health conditions. That's part of the Affordable Care Act. Also part of the Affordable Care Act is the increase in school-based health clinics. Also in the Affordable Care Act is the Electronic Health Records Initiative. All of this is put together. If you will look at the next document, which is titled CMS, Integrated Data Repository. Within that Integrated Data Repository, now these are initiatives that are in place. These are initiatives in place that are being put in place. You'll notice that their goals, that I've highlighted their goals. Number one, that they want to move from a transition from a claim-centric orientation, meaning that whenever a Medicaid, again, we're going back to the fact that under Medicaid, that the Bright Futures is the adopted standard by the Medicaid organization, the HHS. It is the adopted standard. So whether or not I, as someone who has private health care, go to a physician who does or does not use AAP, what you are saying is that if you go through the Medicaid, you will be using the AAP because it is their adopted guidelines, okay? And that's, as an advocate at the national level, my concern isn't just for my level. My concern is for privacy of all citizens, including our poorest and most vulnerable people, whose information, if shared, could actually hurt them in ways that maybe I wouldn't get hurt because of maybe behaviors that they're engaging in. So you'll notice they go from claim-centric to a multi-view orientation. This is not my words, this is their words. And if you'll look at the list of what they want to include, you'll notice it says clinical data, meaning health records, clinical medical data. If you look down next, it says provide users with the capability to analyze the data in place, instead of relying on data extracts. And then integrate claims data, Medicaid claims data, from diverse sources such as Medicare and Medicaid in a meaningful way, which means they're going to look at the data in certain ways. If you look at the next record, this is basically talking about the technical assistance to the states under the Children's Health Insurance Program, obviously Medicaid for our children. You'll notice that the reports and issues brief in the middle, I've highlighted this section. They want to increase availability of CHIP data into the MSIS and potential uses for the data. And if you look at the next, it says how to link enrollment records across systems. And then they want to prepare reports for the CHIP. Now you have to understand, under the Social Security Act, which is what Medicaid comes under, they require reporting and they require certain things to be reported in order for you to get the money from the federal level. If you look at the next record, It's a letter that has been sent from the Federal Department of Human, US HHS. At the bottom, it says, under the Affordable Care Act, that they are strengthening provisions that require states to include data elements. The Secretary determines necessary. So it's not just in the writing, but whatever the Secretary determines is necessary to evaluate their program integrity, oversight, and administration. And if you look at the next page, you'll see the system, the way they want to pull the system together and link them together. If you look at the next document, again, I'm trying to go through these very quickly. The next document on the second page, what is it that's required under Medicaid to be sent? And if you will look, under medical records, documentation must include a note indicating a visit to the primary care physician, the date when the well child visit occurred, and evidence of the following. And if you'll look at the bulleted list, a health history, physical development history, mental development history, physical exam, health education, and anticipatory guidance. And that's some of the stuff that she was reading to you, where they were documenting the different safety and the other issues as well. And then the next document, it looks like this right here. This is Louisiana's Medicaid plan. Basically, under this Medicaid plan, and this is their documentation, they want to increase the percentage by 10%, the number of pediatric primary care providers who are implementing the developmental screening per Louisiana guidelines. If you read the Louisiana guidelines, the AAP are the guidelines. Those are the adopted guidelines. And you'll notice in the section it says to include social, emotional, environmental, trauma, autism, ADHD screening. And you'll notice down, and again, this is the Louisiana document. This is the Louisiana plan, not the federal level. You'll notice it said in accordance with the Bright Futures guidelines. So there is no opting out for those who are under the Medicaid, even though I might be able to opt out. Our Medicaid recipients will not, because that's part of the requirements. If you look at the next page of this document, you'll notice that all children, these are objectives that they have to meet in order to be able to receive the Medicaid. It's their evaluation of their Medicaid program, and these are objectives that they have to reach. All children will receive, it doesn't say just certain children, it says all children receive periodic wellness checks. Again, you'll see in accordance with Bright Futures guidelines. If you will look on the next page, you will notice that on December, on the 9 of 16, it says December 31st, 2016, which is this year, that the state will develop the ability to monitor and report on the utilization of adolescent level visits by parish, payer, and provider. The last two I want you, that I would like to address is the document that says capturing social behavioral domains in electronic health records. You'll notice that document. And then you'll notice the last document, which is a report that was done by the U.S. Department of Health and Human Resources or Services, and this actually includes a Louisiana component. And in this component, you have a school-based health clinic. That is being promoted by the Affordable Care Act through Medicaid funding as well. If you look at the bottom of page 15, which is that front page, it says it allows the school-based health clinics, and by the way, the wellness checks are acceptable through school-based health clinics. In other words, if they want to do it through, they're allowed to do it. Through Medicaid, they're allowed to do it, and the school simply bills Medicaid for the wellness check. It allows the school-based health clinic staff to access and extract academic data from student education records for those students who receive mental health therapy from a school-based health clinic in East Baton Rouge Parish. This relationship, and please look at what it says, overcomes one of the most fundamental and pressing barriers to linking data, FERPA's restriction, that's the federal law, FERPA's restriction on academic data by health practitioners. I would ask that you oppose this bill for multiple reasons, and one of them being is that while it sounds great, we already have mechanisms to contact parents. If you want to require the schools to send home a letter at the beginning of the year reminding parents to have a wellness check, I'm fine with that. But to require them to have a wellness check, knowing that the Medicaid will not allow them to opt out of this, is, to me, it's an overreach, as she said. And as someone who works with a lot of parents, particularly at-risk children, as an independent consultant and as someone who helps in educational issues, some of the parents have said to me that they have walked out of doctor's offices when they went for their Medicaid checks because they were asking them things that they felt were entirely intrusive, and they should not have to, just because they're on Medicaid, they should not have to give up their privacy. And I absolutely agree with that. Thank you for your time.
Thank you, Ms. Myers. Senator Walsworth for a question.